Welcome, everyone. Today, we're talking about the latest in Alzheimer's progress in diagnosis and treatments, support for families, and how we tackle stigma head on. We're joined by two outstanding guests. Muffy Walker is a psychiatric nurse, longtime mental health advocate, founder of the International Bipolar Foundation, and author of Memory Weavers, a caregiving rooted novel that captures the complexity of early onset Alzheimer's and trauma related disorders, shining a light on the profound impact of friendship and human connection in the face of adversity. We're also joined by Dr. Sharon Cohen, is a behavioral neurologist and the medical director of the Toronto Memory Program, a leading memory clinic and research center where she's helped advance early diagnosis and access to clinical trials. Muffy, Sharon, thanks for joining us today. How you guys doing?
Good morning. Hi, Solomon. I'm doing well. Thank you.
Great to be with you. All good here. Thank you.
Well, again, I'm Solomon Wilcots, your host for this special program exploring science, caregiving, and human side of Alzheimer's. Before we dive in deeper, let's get a quick introduction in your own words. Muffy, can you explain more about your background and what brought you to this work?
Yes, I am a psychiatric nurse practitioner. I obtained my graduate degree in nursing at the University of Pennsylvania, and I worked for about 20 years in the platform of survivors of abuse, so a lot of PTSD patients. And I also have a family member who was diagnosed with bipolar disorder over 23 years ago. So that was where the founding of International Bipolar came from.
Sharon, can you give us a brief introduction, your current clinical focus, and why you decided to devote your career to Alzheimer's?
I think neurology chose me. Even as a child, I was fascinated by how do we know how to speak? How do we say what we say and think what we think? And those thoughts carried me through all of my childhood and adult life. The brain is mysterious, beautiful, fascinating, but when things go wrong, it is devastating for people. And I really believe that Alzheimer's disease is a treatable and curable disease. And I've been working for the last 30 years to get us further in early diagnosis and new treatments. And the last few years have been very rewarding. We are having successes.
Well, that's really good news. And Muffy, your novel, Memory Weavers, is set in the late 90s, early 2000s. It captures what Alzheimer's looked like and felt like then. What did you want readers to understand about that specific era?
So I wrote the book Memory Weavers, as you can see here, and it is fiction, but it's based on the playbook basically of my mother, who was diagnosed with Alzheimer's over 24 years ago. My mother-in-law now has Alzheimer's, so I've been a primary caregiver to two parents with this disease. The point that I want to bring out about my fiction novel is that it is based in the early 2000s, before we had all of this transformational work that is taking place. And I'm sure Dr. Cohen will tell us a lot more about that. But I do give a lot of educational pointers in the book that have been endorsed as scientifically and neurologically spot on. But I point out once again, this is based in the early 2000s. So there is a lot more hope, a lot, many, many more options than there were when my book takes place.
Sharon, if we were to fast forward to today, what is the biggest shift from that era to now in terms of diagnosing Alzheimer's?
Absolutely, huge shift, paradigm shift. So I started my training in the 1990s and actually in the 1980s. And in those days, we really didn't recognize Alzheimer's for what it was. It was conflated with dementia, meaning you were very impaired, later stages of dementia. Anybody who had mild memory loss, that was just considered normal aging. And we were wrong with clinical criteria a large percentage of the time. We would say people had Alzheimer's when they didn't, or we'd missed the diagnosis and they actually had Alzheimer's disease. So now we have PET amyloid scans, we have spinal fluid analysis, and most recently, blood tests with high degree of accuracy for diagnosing the disease in life, not at autopsy, but accurately in life and early in the disease, even before symptoms arise. If you can imagine a blood test that can say, yes, you have the brain changes of Alzheimer's starting, but you're still cognitively well. Well, that's the point you want to intervene. Just like with cancer, you don't want to wait until you have metastatic cancer and then you go, oh, yeah, I guess you have cancer. Well, that's what we were doing with Alzheimer's disease. Very unfair. And now with early diagnosis, we actually have some treatments at early symptomatic stages that slow down the disease and keep people in their homes, active, doing things they want to do for longer. We haven't cured the disease yet, but I do believe we will get there. And once we have these same treatments read out in studies that show that even before symptoms arise, we can slow down the disease so that people may never develop symptoms, that will be the huge game changer.
I like to hear from both of you as we get more specific on early detection and starting with you, Muffy. Why does diagnosing early, why does that really matter? And what advantages does it give patients and families?
Well, I think as Dr. Cohen just mentioned, we really can intervene much more quickly. And there are just so many more resources available now with regards to support groups and 800 numbers and literature that as soon as we can find out there's a diagnosis, we can get more proactive in diet and exercise, etc.
Yeah, I think that's exactly right. Having a clear diagnosis is often the gateway to accessing care, and not just pharmacologic treatments, but support groups, information, lifestyle counseling, all kinds of things that can make a difference to people's quality of life. And if you are just conflating early Alzheimer's with normal aging, you're not going to be able to access those kinds of resources.
As it pertains to stigma, we still see people hiding their symptoms or delaying the care out of fear. Muffy, what are some of the most effective ways to reduce stigma around cognitive health?
Well, this really ties in very well with the work I've done in mental health and bipolar disorder, where there is a lot of stigma. I personally am very open about issues. I treat these issues just as they are, another disease of a different organ in the body. So whether it's the brain or the pancreas or the kidney, it's just another disease, and I'm very open about it. With both my mother and mother-in-law, there were no secrets about the diagnosis. And I think what happens is when you open this up, it opens the door for other people to then say, oh, yeah, my grandfather, I think, had Alzheimer's, or I'm taking care of my mother now and I'm really having a hard time with the caregiving. And then you can offer the education and the support.
Yeah, and I think it's important to realize that stigma comes from many sources. It's with us in the community, these antiquated ideas of Alzheimer's disease, a frail elderly person. Well, there are young people with Alzheimer's and many who are still in the community and active. So these classic sense of what Alzheimer's is don't serve our population well. And then physicians need more education so that they don't just brush aside, oh, you're a bit forgetful, there's nothing to see, don't worry about this. And or if they then find something, all of a sudden they're suspending someone's driver's license and not offering much hope about anything. So I think that whether it's the healthcare provider or the community at large, there are lots of sources of stigma that we still have to battle against. And I like Muffy's comment that, this is a disease like any other disease. It's rooted in biological change, and we need to be compassionate and address it in a straightforward, forthright manner.
Can both of you respond more about the caregiving and partners that this disease touches the entire family, right? So, what does partnership look like, and what does support look like in the real world? And how can couples share the load without burning out as they are caring for their loved ones and family members?
A great question. And I think that there's this saying, if you've seen one person or one family with Alzheimer's, you've seen one person or one family. It can be quite different family to family, the experience. Some people with Alzheimer's disease are quite aware and grateful and, relatively free of behavioral disturbance. Others are agitated, wandering, aggressive, paranoid, insisting you're not my wife or this is not my home. Really challenging behaviors. And I think that things that don't work are trying to talk people out of their delusions. You try and continue to support people with the things that are enjoyable and intervene where you can. You have to pick your battles and you have to seek some professional guidance often because caregiving. This is caregiving of a, it's a real run for your money here. This caregiving in late stages of Alzheimer's in particular, and it's not something someone should shoulder on their own.
I will add that we know that more women than men are diagnosed with Alzheimer's, and more women than men carry the burden of caregiving. That's a very important fact. There are many organizations out there for caregivers, a lot of support groups, and just as I did in my work in mental health, I will say what they say on the airplane: put your mask on first before you help the person next to you, because you will burn out. It is a long journey. It is a long, tiring journey, both emotionally, financially, physically, in some cases, and you really need to get support.
Yeah, I think that's so true. There's no sugarcoating it. And yet, when I speak to my patients and their families, I do try to help them focus on the positives. Even in late stages of Alzheimer's, there can still be joy, there can still be sharing of activities and family events. And often people get so mired down in the negatives and the burden that they forget to see that, mom's still here and that means a lot. And, sometimes sadly you only realize when she's gone that those moments with her were so precious.
Great advice from both of you. Sharon, what's exciting right now? You were recently at the AAIC in Toronto. So give us the top developments that you're witnessing and seeing right now.
Sure, this was a mammoth conference. It's an annual conference, and the membership keeps growing. The audience was over 10,000 people in downtown Toronto, so it was a little insane, but lots of new learnings. I think the atmosphere was very exuberant. People are expecting that the field is moving forward, unlike in previous years where we were sort of mired in failures of drug development programs. Now there's this huge expectation that we're learning more and more each time we get together. We did have readout of an important lifestyle study that confirmed that structured or self-guided attention to brain healthy behaviors, so cognitive and social engagement, dietary pattern, and physical exercise do improve cognition in people who are at risk for Alzheimer's. So that was exciting. Another plus for, us counseling not just our patients, ourselves on brain healthy behaviors. We got a glimpse into some real world data for two of the drugs that have been on the market now for a little while. The earliest one to be approved, lecanemab, that slows disease, seems to be very well tolerated in real world practice, not just in clinical trials, and patients are adhering to the infusion schedules, to the MRI monitoring, and appear to be relatively stable out to a year or 18 months, as long as these real world studies have been conducted. And there's great enthusiasm for new drugs that are still in clinical development, but have even lower side effect rate, clear amyloid, this bad actor in Alzheimer's disease, this early protein that accumulates. They clear it really quickly and with minimal side effects. So we're all holding our breath, waiting for phase 3 development and readouts.
Sounds very encouraging. And Muffy, looking ahead, what near-term changes would you love to see in clinics or communities that would really make the biggest difference?
Well, I think Dr. Cohen alluded to it earlier that the general physician, just like we take the blood pressure and weight, et cetera, there's no reason why they can't take a 30-second memory test. And I'd like to see that included in a general physical, just as I'd like to see mental status exam done in a general physical. And there's also a new study out called the aptwebstudy.org, and it's free to anyone over the age of 50, where it marks your cognitive benchmarks. And then you take this memory test every 4 to 6 months. And if it notes that your cognition is declining, it will start increasing the test and then maybe make some suggestions or even suggest a clinical trial. And this is a free study, a free global study that anyone over the age of 50 can sign up for. So I'm all for getting the information and finding out as soon as you can.
Sharon, let's get practical for listeners right now who are listening to this conversation and they're wondering what they can do starting this week. What are some of the top habits shown to protect brain health?
Yeah, there are lots of lifestyle changes or strategies, as I mentioned before, and these include eating a brain healthy diet. So a diet that has lots of fruit and vegetables, not too much red meat, not too much animal fat, more olive oil than other kinds of oil. And physical activity is not just good for the heart and the bones, it's very important for the brain. So moderate intensity exercise at least 3 times a week would be a ballpark goal. Sleeping well, if you're not sleeping well, and sleep escapes many of us, get that checked out, because during sleep we clear toxins from the brain and we also consolidate memory. So there are a host of lifestyle changes. But I think beyond the lifestyle strategies, which are very important, one should also be honest with oneself. If you're worried about your memory, even if your symptoms are very mild, or if you feel you're at risk because of a family history or some other reason, get this checked out. You owe it to yourself not to let things simmer, because if this is the beginning of Alzheimer's disease, brain cells are dying, and you only have so much time before you can't turn the clock back. And brain cells are affected in Alzheimer's disease before symptoms start. So really get a jump on things. Speak to your doctor. Insist on, as Muffy says, a cognitive test or a referral to a memory specialist. And I think you'll find that patients will drive forward the field.
Last question before we go. Here's our list of resources. Muffy, why are these organizations important and how can people use them?
Well, these are all open to the public. They offer anything from resource manuals to support groups to global brain health. I think that they're just yet another tool in your toolbox.
Well, we want to thank you both, Muffy, Sharon, for taking the time to join us and sharing some precious resources and knowledge that we think is going to be very insightful and that can help patients and caregivers lead a more active life. And as you said, take care of loved ones and enjoy the time that we all have with one another. Thank you for joining us.
Thank
Thank
you.
you.